the relationship between the nose and also the voice. During the voice production, the larynx undergoes the adduction. It produces the turbulent airflow. It will reach as the oral cavity and nasal cavity, and voice is produced. So this is how the voice is produced. Larynx undergoes the adduction. It will produce as the turbulent flow. It will reach as the nasal cavity and the oral cavity, and voice is produced. So if there is any obstruction in the nose, it will lead to the decreased nasal component, which is known as, or the hyponasality. It is termed as the Rhinolalia clausa. Any palate insufficiency. If there is any insufficiency in the palate, the air will enter. If there is any insufficiency in the palate, air will enters into the oral cavity, enters the nasal cavity, increases the nasal component. This is known as hypernasality, which is also called as Rhinolalia aperta. This condition is known as Rhinolalia aperta. So this what happens during the voice production. The vocal cords undergoes the adduction. There is a turbulence of airflow and voice is produced. If the oral cavity component, if there is any palate insufficiency or incomplete palate, oral component will decreases and nasal component will increases. This is known as Rhinolalia aperta. And nasal component, if a nasal component decreases, this is known as Rhinolalia clausa. So any obstruction in the nose, that is a concha-bullosa or any DNS, malignancy, edema, infection leads to Rhinolalia clausa.